Cerebral palsy. Cerebral palsy. A group of permanent movement disorders that appear in early childhood. Symptoms often include poor coordination, stiff muscles, weak muscles, and tremors. There may be problems with sensation, vision, hearing, swallowing, and speaking. The babies may not roll over, sit, crawl, or walk as early as other children of their age. Other symptoms include seizures and problems with thinking or reasoning. Types: spastic cerebral palsy, spastic hemiplegia, spastic diplegia, spastic quadriplegia. Affects the motor cortex. Spasticity or high muscle tone, often resulting in stiff, jerky movements. Ataxic cerebral palsy. Damage to the cerebellum. Intention, action, tremor, difficulty in coordinating muscle movements and balance. Dyskinetic cerebral palsy. Damage to the basal ganglia. And substantia nigra due to bilirubin encephalopathy and hypoxic-ischemic brain injury. Both hypertonia and hypotonia. Mixed cerebral palsy. Periods that the damage may occur: pregnancy, delivery, first month of life, early childhood. Causes: abnormal development or damage occurring to the developing brain. Genetics, birth. Defects: preterm birth, born prematurely, low birth weight, hypoxia of the brain, asphyxia. Thrombotic events: placental insufficiency, umbilical cord prolapse, meconium aspiration syndrome. Harm in intrauterine development: exposure to radiation, infection, fetal growth restriction, birth. Trauma during labor and delivery. Complications around birth or during childhood. Toxins, severe jaundice, lead poisoning, physical brain injury, stroke, abusive head trauma, incidents involving hypoxia to the brain, e.g. near drowning, infections, encephalitis, meningitis. It is not a progressive disorder, but the symptoms can become more severe over time. They may improve somewhat during childhood, but once bones and musculature become more established, orthopedic surgery may be required. They can have varying degrees of cognitive impairment or none whatsoever. Therefore, the intellectual level varies from genius to intellectually disabled, as it does in the general population.